Hey, everybody, welcome aboard. This is John Sovak, and I'm your host moderator for today's conversation. And I'm really excited to have all of you joining us as we really look today at a conversation about creating equitable healthcare for sex workers. And we have an amazing panelist, and I'm really excited about this conversation that we're having. Right now, we're in the middle of May and it is Mental Health Awareness Month. And unfortunately, what we look at for the LGBTQ community, and especially for LGBTQ youth, that access to mental health care is often a really challenging thing for them to achieve. Trevor Project states in their latest studies that 50% of young people who were searching for mental health care in the last few years who were LGBTQ couldn't get it. And so I really want to encourage you to take some time for yourself, or to encourage others who may need access to care to look at the outlist or utilize some of the free support sessions that are available through our partners at peers.net/outcare. Really cool organization providing support for the LGBTQ community. And everybody knows June is just around the corner, and that is Pride Month. It's just about here. If you or your employer are really interested in supporting LGBTQ health equity, we are always looking for committed Pride sponsors to support our work. You can support it by making donations yourself. And even more important, you can make that donation go farther if you have employee match for your donations. Something to look back if you're working in the corporate world. You can donate to us at outcarehealth.org/donate. So that's kind of the stuff to start us off with. But I'm so excited to have this panel of people joining us today with their expertise in this conversation. And I'm honored to just sit in this space with them. So with that said, I'd like to encourage each of our panelists to introduce yourselves, tell a little bit about who you are, the work that you do. And this is the fun part. They get a super deluxe bonus question that none of them have heard until this moment. Okay, so here we go. It's late in the afternoon. You're having your cravings. Is it sweet or salty? And that's your bonus question. So if we're okay, Ashley, would you like to start us off today?
Sure. Hi, everyone. My name is Ashley Madness. I use she, her pronouns. I'm on the steering committee of Decrim Sex Work California and of Sex Workers Outreach Project Los Angeles. Um, the Sex Workers Outreach Project Los Angeles is a grassroots mutual aid and peer support organization by sex workers and for sex workers. And we provide things like a virtual open to all sex workers countrywide to know about this peer support group, drop-in peer support group, and we go out on a monthly basis to do outreach with street-based sex workers. We're also very involved in research, art-based advocacy, and policy, which brings us to Decrim Sex for California, a coalition of sex worker organizations and organizers and supporters of based in California that support the human rights of sex workers and seek the liberation of sex workers and decriminalization of sex work. And in my afternoon craving, I usually don't eat much throughout the day, so I am very excited to get straight to dinner. So I will go with salty. Thank you.
Thank you. Randy, go ahead.
Hi, my name's Randy Singer, and I am a nurse midwife, and I'm on faculty at University of Illinois Chicago in the College of Nursing, and on the board of Southside Health Advocacy Resource Partnership here in Chicago, which aims to serve those on the South Side and involved specifically with the house ball community and Southside Health Advocacy Resource Partnership. I do community engaged research. Midwives present, yes. and I don't know. So I shouldn't look at the chat. So yes, I do community engaged research with sex workers and working toward equitable healthcare, and have been involved in decriminalization efforts as well, along with both local in the city of Chicago as well as in the state of Illinois.
And your
Oh,
afternoon craving suddenly starts building up.
Craving. I mean, ideally it's both, right? It's like a little popcorn with some Swedish fish together, like in the same bite, and maybe even a little M&M thrown in there. So.
Ooh, I like your style. Yes. Mix them all together in one big bowl. Perfect. Thank you. And Addison.
Hi everyone, I'm so happy to be here. My name is Addison Lakowski. Any pronouns are fine. I definitely prefer my name if you want to refer to me in a question or anything. I am based in New York City. I work for the COIN Clinic at Cal and Lord. COIN stands for Cecilia's Occupational Inclusion Network, named after the late Cecilia Gentili. We are a small clinic within Cal and Lord that serves sex workers. So I'm sure we'll get into the details of the program, but we serve about 700 patients at this point. We offer completely free healthcare services to anybody who identifies as a sex worker. I work as the case manager, so I'm kind of on like the social worky side of things, and I just help patients navigate through the healthcare system. My previous history is at other healthcare facilities across New York State in LGBT health. So I've worked with a lot of trans patients in the past. And I'm going back to school in the fall to pursue my MSW. So I'm super excited about that. And for my snack options, I'm definitely not much of an afternoon snacker, but I always need a snack after dinner. I'm definitely like I need a sweet treat after dinner. So I like to have I'm obsessed right now with those little like mochi ice cream balls that are like have like mango ice cream on the inside. They're so good.
Yes, love those, know them quite well. Yeah. So once again, my name is John Sovek, pronouns he, him, and I am a therapist here in Pasadena, California, and I specialize in working with LGBTQ IA plus kids and their families during the coming out process. I'm also the author of Out, a parent's guide to supporting your LGBTQIA plus kid through coming out and beyond. And right now, actually during the course of this recording today, I am receiving an award from ASEC, a literary award for my book for 2024. So I wasn't able to attend that because I thought it was so much more powerful to be here and converse with all of you. So yeah, it's really exciting news, and it's really fascinating to watch the life of this book move on and go into all kinds of different spaces. It's really exciting. Sweet or salty? So if it's in the afternoon and I'm here at the office, it's usually salty. But Addison, I'm like you, after dinner, like something sweet has to happen. So that would be, I would say I would mix up a little bit of both depending on when it was in my day. So kind of focusing us now onto our conversation, I think for me and maybe a lot of people who are joining us, it's really important to maybe look at this idea of, well, what is a sex worker? We have all of these very misconceived ideas from popular media, anywhere from like Pretty Women to characters on Pose. So really, what is a realistic idea of where we start this conversation? Who are sex workers as you're experiencing in the modern world currently? And Ashley, I'm going to start with you.
Yeah, hey. So this is a something we often cover in our SWAP LA Sex Work 101 presentations where we kind of just go through the basics. But the two key parts to what is a sex worker are kind of like, what does the word mean? Like, and we define it as anybody who exchanges an erotic service for anything of value. So something sexual for money usually. And then the other part of it, and I guess on that part, it can be lots of different erotic services. It could be in-person sexual services, like what I do as an escort. It could be online sexual services. It could be uh, BDSM or kink services that aren't necessarily sexual, but they might be sexual, and they are definitely sexual enough to sort of count for criminalization and stigma. So they count with our definition. And then in terms of the other part, I think of like, who do you imagine when you think of a sex worker? And that maybe is the more important part. And it's very much like anybody, you know, and maybe there definitely are sex workers who have one type of sex work they do, and they do it full time. And you can kind of think about, what does it look like to be a full-time dominatrix? Like you might think of, what does it look like to be a full-time construction worker? But the way sex work is often some types of sex work into your life in some pieces. And anybody that you know, imagine that they also, for a few hours every night, turned on a cam and masturbated to an audience. And that's what a sex worker looks like, or did something else just in addition to whatever else you might think of someone. So very much three-dimensional people, just like anybody you might know, but they do provide some kind of erotic service.
Mm-hmm. Randy, Addison, anything you might add to that to help everyone understand a little bit more clearly?
I think you did a great job, Ashley. I think the only thing that I might add is the work part, is that, when we think about, I think in general, when people think about work, that's not work that they're thinking about. And so it's really important that when we think about sex workers, that they're doing a job, they're doing a service, and it's work.
Mm-hmm.
Yeah, I think the only other thing I would want to add is that I personally think it's important to make a distinction between folks who are choosing to engage in sex work on whichever level by their own accord, and folks who were maybe coerced or forced or otherwise exploited into the sex trade industry, and that there's a difference between consensual sex work and sex trafficking. So just keep that in mind as we get deeper into the conversation, that we are absolutely not advocating or condoning sex trafficking. But we support people who have all different types of involvement in the industry.
And maybe you could go a little bit deeper into helping our audience understand those different approaches, those different ways of coming into the sex work community.
Yeah, for sure. I think I like to kind of peel it back to like a kind of a grand scale, like think about just like how capitalism functions and how our lives are so expensive, and it's incredibly difficult to access our basic needs like housing and food and education and healthcare. And because of that, and because of so many different intersecting factors, there's a lot of different levels to like choice or coercion or circumstance that draws people to sex work. So I think it's just important to take it on like an individual level of what each person's individual circumstances are and reasons for joining sex work. In my experience, it's usually pretty apparent when somebody is not doing it on their own accord and has been forced into it. There's a lot of signs and like context clues. And there is some overlap in how we, provide for those patients in a healthcare setting. But there's also a lot of differences too.
Mm-hmm.
I could add to that a bit. One reason I think Addison felt it's so important to make that distinction is often we see sex workers portrayed as two extreme opposite sort of tropes. They're either totally forced into it, have absolutely no autonomy or ability to make any decisions for themselves, taken advantage of, or they don't care anything about anybody. They have the easiest job in the world. They lay back while thousands get in and they orgasm. And in reality, the vast majority of people who have experience doing any kind of sex work, it is somewhere in the middle. And there is a certain hysteria around sex work and a lot of media and funding for certain types of work that capitalize on this hysterical view that anybody who could be trading sex must be doing so out of being forced to do so, that there's no possible reason that you could decide to have sex for money other than your passport being stolen or a gun being put to your head or something horrific. When in reality, I can think of 200 reasons to accept $200 for a blowjob. like we have to pay our bills, and that is such a huge component of why any sex worker participates in the, or why most sex workers participate in the trade. And kind of like Addison said, with our services, like at Swap LA, for example, we want to offer support to anybody who's had an experience of exchanging a sexual service for anything of value, regardless of whether they might have been coerced into doing that and don't want to do it in the future. Maybe they've escaped that situation or not, or whether that's just a choice they made to pay their bills in society. And having a definition like that to include people as identifying as sex worker, even if you were forced into this work and your wages got robbed, we'll definitely still try to support you with services, but kind of understanding that if a client comes to you and you hear something that implies that money was exchanged for a sexual service, don't leap to oh my gosh, who's threatening you. But there could be signs like Addison saying stuff does add up.
And I kind of feel as you're speaking, there's also a subtle but also huge distinction between coerced and forced. And I'm wondering if any of you could address that phraseology too, because I think there are, once again, I think people have very strong black and white ideas of the population we're talking about. And I think these subtleties are really important as we're starting off this conversation. So this idea between coerced and forced, anybody have any thoughts on that?
I mean, what is the difference between like the ways that we're all coerced into labor in the US, especially? Just because it's a sexual service doesn't make that any more coercive than any type of labor that anybody else does.
Mm-hmm. Randy, I see a thought forming.
Forming, it's not quite there, but I think that I completely agree with what you're saying, Addison, and I think there is a lot of nuance between coercion and force, and there's coercion that can happen. You can choose to be in one situation with a client, for example, and then there could be coercion that happens in the middle of that situation that was unanticipated. And then force, a lot of times I think about, I can't help but think about the cops, right? I can't help but think about physical assault and physical abuse and the way that plays into people's lives.
Mm-hmm.
Yeah, so there's a federal statute saying that defining trafficking, sex trafficking as any commercial sex induced through force, fraud, or coercion. And that statute sets force, fraud, and coercion at kind of equal terms when, and there are other crimes, obviously, like kidnapping, assault, that if physical force is what's happening, maybe there's other crimes you could prosecute, I suppose. But when I think of force versus coercion, the first thing I think of is the police, because I think numbers wise, it's pretty clear that police coerce sex workers into performing sexual services on them far more often than anybody is, any sex workers or any people who are, far more often than anybody is coerced into performing sex work other than for a cop. So that's sort of the first thing I think. And so on the one hand, maybe thinking and one thing that definition does is it kind of lets all the trafficking funding be justified based on the most horrific imagining of what trafficking could be. And then in reality, you arrest somebody's roommate for saying like, oh, I'm going to kick you out if you don't pay rent. I know you have the money because I know you have extra clients, or I know you have clients coming in and your rent's been overdue for 2 months. Now that person is trafficking their roommate. You can, arrest the roommate also on conspiracy to traffic herself, maybe, depending on your jurisdiction. And then you finally have a trafficking arrest, and you say, just so insidious, it's all out there, and you only are able to get the tip of the iceberg. But often the few trafficking arrests they get are people trying to help out or just work with a sex worker. And they say there is an element of coercion that's just enough to get the charge to be pled to, you know.
Mm-hmm. Well, and also, I mean, we do have a lot of clinicians on us joining us today, and I think another, piece of this puzzle is, how do you feel the criminalization of sex work interferes with access to healthcare, like the basic ability to get the most fundamental levels of healthcare? What would your thoughts be on that and how that's playing out in the community as well?
So I think that, targeted policing, and I think that as far as healthcare is concerned, I think people are afraid to disclose when they go to their healthcare providers. And of course, you can't talk about that without talking about like stigma and discrimination that happens within the healthcare setting. It's amazing that some places, have sex worker specific clientele, or people know that they can go there safely. That's not the case everywhere. So if you look in rural communities, I mean, and there's not a lot of spaces where people can go and acknowledge that they are doing sex work openly. And an example, and there's a lot of myths that care providers have, right? About just some of the ones that we were just talking about who are sex workers and are they doing this of their own accord? And I've heard of examples that, people have had the cops called on them because of a provider feeling like they were, somehow doing right by their patient by preventing them from doing harm or something like that, but they're then taking their autonomy away. And that's just one example. I can yield my time.
Yeah, that's spot on. I think the effects of criminalization and generating just a atmosphere of fear is so intense, even in a place like New York City and a healthcare facility where we do have explicit dedicated services. People are still so scared to come forward and ask for services through the program. And I think I probably spend 80% of my time like mitigating that fear for my patients. Um, and yeah, I think there's a fear of disclosing to a medical provider on the level of, prior bad experiences of getting denied care or facing further policing at the hands of their healthcare providers. I think there's also like this larger level of your healthcare record is like subpoenable in a court of law. So a lot of people are like so worried about how that information is getting documented in their medical record. And if that could ever get back to or in the wrong hands of somebody who could put them in jail or deport them from this country. So there's just a lot of fear, and the stakes are really high right now.
I definitely would echo. Yeah, I definitely would echo all of that. And I will add that I think there's a more subtle barrier where so we do some research at Swap LA. One of the things we did was this focus group of parents that do sex work. And I think that just got a set to be published a couple days ago, the paper on it. But since then, we already had our first community building event with the parents, and we got funding for a zine and documentary project, which is very exciting. Alyssa's helping with the documentary. Thank you, Alyssa. But one of the biggest themes of that parents focus group and of a series of policy focus groups we just held, and of a lot of informal talking to community as well as needs assessment. There's a huge theme of social isolation, where it's like, some of the problems that some sex workers have, somebody will be nearly houseless or struggling with that. Somebody will have been recently really messed up by a trick. Somebody will have recently been messed up by a cop. And then the everybody will say, we are so isolated. And then the situation with the parents, it was you could just so easily imagine at the PTA meeting, you can't say anything about your work. You have to, like, if work comes up as part of the small talk, you wouldn't say anything real. You'd have to make up a job and be acting like you have to do at work pretty intensely as a sex worker, just to get through your PTA meeting. And that social isolation, in addition to, a stigma from the provider, it means you just hear of less resources. You don't know what's going on. It's harder to find other sex workers who recommend stuff. And if you have friends who would know stuff to recommend if they knew what your needs were, but you never really talk to them, so you're not even friends in the first place, or you don't talk to them about work, or you don't talk to them about huge fractions of your life, then you yeah, you lose out on a lot of, access to healthcare that is maybe less thought about.
Mhm. And because we are with Outcare Health, I think it's also important to look at the like multiple minority status of also being LGBTQ and a sex worker, or LGBTQ and a person of color and being a sex worker. And how do you feel those additional layers play out? When you're talking about the isolation, Ashley, that's one of the first things that came to my mind. How do you think those multiple layers of minority stress play out in this conversation we're having today?
Definitely in terms of healthcare access, specifically, it is sort of striking where, if you're like 2 out of 3 of low income trans, oh wait, no, maybe 3 out of 4, a sex worker and a person of color, there's only two places in LA to get your healthcare. And so, it's a huge city, huge metropolitan area. And if you're a low income trans person of color, like, there's between all of the organizations in LA having, not being competent to serve you in a certain way or another, or often what happens is, I'm a provider. I have several subconscious biases. Maybe I've tried to work on them a little bit, but it's not until they really stack up that I really forget what my job is and treat somebody like total shit. But the fact of the matter is, like, if you fall out of enough boxes, there's nowhere to go. And that's a huge problem we face, where even if all the services in LA were sex worker affirming, we still would have plenty of sex workers who can't get good services for lots of other reasons, right? We need a much better, we need universal health care so that we're not worried about paying for it to begin with. But then, yeah, we need to be better about the board.
I agree. And I think I just saw briefly that somebody said something about physicians receiving no training, and I think that's important to acknowledge. But I think you were saying like the multiple barriers. So if you have somebody, if you look at all of the historical trauma, right, that has happened, medical racism, the trauma that has plagued, the LGBT community within the healthcare system, and then sex workers who come in and it's multiplied. And the lack of training is huge. It's really huge because people are getting trained in all sorts of things. And I think there's a lot of phoning it in that's going on with the training right now. And this has been deprioritized or never prioritized. And in order for there to be any sort of change in the way that we're treating our patients, I 100% agree in universal healthcare. But I think that that there not only needs to be, and I think I might be digressing a little bit, but there not only needs to be trainings, but they need to be interactive trainings. They need to have simulations. They need to, offer opportunities for providers to make mistakes and self-correct and correct one another. And those trainings need to be developed in partnership with sex workers with multiple marginalized identities, so that these trainings are not just like developed by me as a white lady in my office. It's something that needs to happen in partnership in order for them to be impactful, effective.
Mhm.
a big change.
Yeah, I would also just add to kind of go back to, I guess, provider stigma. Like queer and trans people's healthcare is already so like collapsed into these like singularities of like, oh, you only need PrEP or hormones or STI testing. And it's like so much more than that. Like we are all whole people that have whole bodies and, you know, suffer from the same illnesses and ailments that every other body suffers from. And we need comprehensive healthcare for our whole bodies. And I think that is already so hard to walk into the very few like dedicated queer health clinics and obtain. And then on top of that, if you're a sex worker, they're really going to be looking at you like you're just a walking STI. So you're going to walk into the clinic and they're just going to want to treat you for your sexual health and not ask you certain questions about the rest of your health, which is so damaging and silencing and ultimately just creates and contributes to like this culture of people not wanting to speak up for their healthcare needs.
Well, that's actually a question that Siri had brought up in the Q&A, and that, what are some of the healthcare services that come up beyond the assumed services, like you said, STI, pieces like that? What are some of the gaps in care that you all have actually seen or noticed that maybe our clinicians listening today would be wise to start addressing in their care?
I mean, I can speak at Coin at Cal and Lord. Our top 3 diagnoses are all mental health diagnoses. So anxiety, depression, and PTSD. It's a huge gap in our care. We do not have great dedicated mental health services for sex workers right now, which is really a huge shame and a huge reason why I'm going to school to pursue that and provide that in the future. I think in addition to that, it's like repetitive use injuries, substance use, sexual and physical violence from clients, and then kind of things that everybody faces, like diabetes or COVID or the flu or gender affirming care.
Mhm.
And dental care. Dental care
Dental
seems to
care.
come up a bunch.
Yeah, which is,
But yeah.
I think the dental care thing is completely related to the barrier of insurance that sex workers face. We do not have insurance. Um, we don't have like a lot of us don't have employers who we can get a cushy like Aetna plan through. And I think we see that at Cal and Lord as like the biggest barrier to healthcare access. And at least in New York State, the insurance system is set up where the cap for accessing Medicaid is super low. If you make too much for that, your only other option is to pay for like a qualified health plan through the marketplace, which starts at like $400 per month. So it's extremely inaccessible. And we see a lot of sex workers kind of making right in that blind spot, I guess, where you are just ineligible for insurance, and that's going to bar you from healthcare pretty much everywhere. So that's a big reason why Coin feels really special, because we can just say, hey, you're uninsured. That's fine. We're going to pay for your whole entire healthcare and try to help you get on insurance. And if folks are eligible for Medicaid or other insurance, we definitely try to help them get on that. But again, that level of fear or just distrust in like engaging in these systems is really huge. Like we have so many patients who might be eligible for insurance, but don't know how to prove their income. They don't get pay stubs or W-2s. They're really hesitant to like apply for public benefits because maybe they've never filed their taxes before and they make all of their money under the table through cash. So obviously we're not encouraging our patients to like lie or commit insurance fraud or anything of the sort, but we're definitely like developing ways to help folks like legitimize their labor and make it look just legitimate on paper and get their benefits if it's possible. So yeah, that's a huge barrier to care that we see for sure.
Well, and one thing that I think would be a great direction to take us right now is really looking at like what can our clinicians, our clinics, our people who are joining us for this webinar, like what are ways that they can make their space feel more available, open? There's something Marissa actually asked really early on in our conversation. They were really looking at what are the things that would make someone feel like they could walk in the door and feel like they were going to have secure access to care? What would be really basic level things that our clinics or clinicians could do to get that message out?
I think that, were you going to say something, Ashley? Because you can go first. Okay. I think that there's little things and big things that we can do. And I think that, you know, as clinicians, we can wear little buttons. We can have a little red umbrella. We can have, you know, a pride flag. We can have pictures in the office that demonstrate that this is a safe space. Only, of course, if it is a safe space. You don't want to, I need to reiterate that we don't want to be all wearing a bunch of buttons if we're not prepared to follow through, right, with that, with culturally safe care. So I think that those are small things that we can do, of course, in addition to the trainings. I think that open-ended questions are super important. And I think I want to acknowledge to the care providers on this call or whatever that that I know that you're double and triple booked. You know, I know that you are seeing tons of patients in a very short amount of time, and we don't have the time, it seems. But often I think just waiting for the answer, if you are able to say something more open rather than yes or no questions, you know, do you have sex with men, women, or both? You know, tell me about your sex life. Tell me, you know, and then stop and look interested. Like I think that how we present and how we truly are with our patients goes a long way.
Ashley,
Yeah,
Addison, anything you might add to that?
yeah. I guess I would also just add to be really mindful that folks may be disclosing their involvement in sex work for the very first time, especially in a healthcare setting, and that might be an extremely uncomfortable experience for your patients. And to just like be mindful of that and be patient. And if you are like kind of picking up on context clues that they might be doing sex work, but they're not really fully saying that, it's okay to like ask a colleague who know might have more experience to like step in and help with that. Like I have a lot of providers who are like, hey, I think this patient might be eligible for your services, but I'm not quite sure. Like, would you feel comfortable telling them? And I often like disclose my own history with sex work to patients to like make them feel comfortable. So if that's something if that's experience that you have, maybe think about if that's something you're comfortable talking about with your patients to just like have more equal footing. Um, yeah, incorporate just the language into like your offices, your health clinics, or wherever you work. Just like saying the words out loud counts for a lot, I think.
I would, one thing that could be helpful, I guess, depending on context, is if you're very upfront with like what's going to be written down in that record. What situations might cause you to call the police if there is any situation that might cause the police? You know, if like, you know, before you start asking the patient questions, you kind of give these disclosures about like to let them know how private and how secure everything is. That can make people feel a lot more comfortable sharing certain things or not sharing certain things or sharing whatever they feel like their doctor needs to know. I think similarly, focusing on like medically relevant stuff seems great. You know, like why are you asking me the gender of people if if you need to know if I need an STI test? You know what I mean? Like maybe some people don't would wouldn't be able to answer should I be tested for STIs or not. But to a sex worker, like you're literally asking medically irrelevant questions, right? If you're asking the gender or some things like that, like how many partners, is like, this is, for a lot of sex workers, this is way more detailed than you're meaning to be. Like, this is there's all these questions, and I'm gonna answer, I'm a slut, I'm a hoe, I'm a whore, yes, I did it, I did it some more, I did it some more. And then by the end, it doesn't feel great. When if you started with, is there any chance that an STI panel could be helpful for you today, if that's what you're doing? And then one kind of big brain idea was, and this is depends on capacity of the org, but if the health space were more positive about sex, talking more about like how to make your sex better instead of just like what goes wrong sometimes and how to prevent that, I think that would make a huge difference. Where I think in this struggle with a lot of people trying to use negative attitudes about sex and gender to do a lot of harm, um, it could be really valuable for the healthcare folks, service providers, to kind of stand up for human sexuality and say, like, actually, it's good to have good sex. It's good to have great sex, and maybe you have some stuff as an org that's not about preventing diseases from sex, but it's about just making the sex better. Could be a fun basis for a community event. Yeah. Okay, those are my ideas.
I think that's great. Having sex positivity like throughout, I think, is super essential. I also think that spaces that where sex workers are working, just like, um, if you can see yourself in your provider, and if it's not your provider, if it's somebody else, if it's going to feel like more of a safer space, if there are other sex workers there, or so I think considering that in some sort of way, or LGBTQ folks, I think those are safer spaces often.
And one of the things we talk about quite a bit here in these conversations is also just having visibility within the communities you're hoping to serve. So not just being a place where you're waiting for everyone to come to you, but that you're actually stepping out into the community, making your services available, making people aware that your services are available, and that you are an affirming space. And I think that's a really big piece of this puzzle too, is once again, not just waiting for, but actively reaching out into communities and say, we are making a commitment to be available for this community. And I think that's another proactive step that a lot of people can take in this process. Yeah, I got head nods on that one. It's a really big mission of OutCare Health to really have people not isolate, but actually reach out and become part of our communities. So Benjamin, you had a question up there. I feel like this little last part of conversation helped answer that one. Then I asked a really interesting question. I think it could be a difficult one, but I'm going to throw it out there to see. So is there like one question that a doctor, a physician, a care provider might need to be able to ask to really respect the intersectionality of their patients who are sex workers? Like, is there a question that they might be able to bring into the room to really create a space where people could feel comfortable to offer their multiple identities in that room? Any thoughts on that? I know it's kind of a real specific, like, big question, but I just was curious on your thoughts.
I mean, I don't think there is a magic phrase, unfortunately, to the extent that's the question. But in terms of what are some good questions, great question, and maybe the more clinical folks here can help.
Yeah, definitely can't think of one magic question. I think it is more a lot of little questions that start even at the front desk, and make it all the way up into the exam room. or even when they're like on the phone scheduling the appointment, that's usually when I have my first initial contact with patients. And I just like to explain like who I am and what I do for the program and ask very open-ended questions like Randy suggested. And just say like, how does this work feel for you? Do you feel safe when you're working? And I think in those types of questions, their other parts of their identities start to come through. Like if they are maybe undocumented and they have a lot of concerns about interactions with the police while they're working, they might bring it up at that point, and then you'll learn a little bit about like that part of them. And they may be seeking gender affirming services at your clinic, so they're good. So you're gonna learn about that piece of them. So yeah, I can't think of one magic question, but I think it really kind of goes back to just having a very open attitude in your interactions with your patients. Yeah, that framework is huge.
And I know one of the things that I bring into my work that I think is actually like a little tiny nugget of that miracle question is simply looking your client, your patient in the eye saying, what are your needs today?
That's what I was gonna say.
Like, rather than just going down that checklist and saying, oh, you mentioned that you need to do this, that, or the other, like take it out of that very clinical framework and look them in the eye, open your heart, connect and say, how can I serve you today? What are your needs today? Is there something on this intake form that is on your mind or is in need of yours that we could help address? Like to move it beyond that checklist, because that checklist can be very, very excluding and it can feel very isolating. And so that's kind of a little like version of my like miracle question that I try and bring that moment, because the person sitting across from me knows what they needs knows what their needs are much more than I do. So we're kind of getting close on time. I want to throw one thought out there. If any of our panelists have any resources or you'd like to make sure people have access to your information, you can add that into the chat feature right now. That's also going to be featured. This webinar will be available for rebroadcast, usually starting next week. So people can go in there and the resources will be there as well too. Where do we want to go now? I want to look a little bit towards this idea of kind of a bigger institutional approach. Like we're all in different states, we've all got different laws we're working with. How can policymakers and healthcare institutions like start to develop more policies and protocols that will be affirming towards the needs of the sex worker community? I see lots of thoughts forming.
It's a big question. I think on like a political level, if you have like any advocacy departments or any folks at your place of work that are particularly passionate about that, support decrim efforts in your state. There's a lot of them right now to try to decriminalize sex work on the state level, which is probably like the singular most important thing we can do to protect sex workers and boost their health outcomes right now. So see if there's an effort decrim actions in your state and jump on that and see what you can do to help. I would say in terms of like protocol inside of the clinic, I think it kind of comes back to this conversation of confidentiality a lot, which is something that we struggle a lot with at Cal and Nord. It's really tricky and very new, the stuff that we're dealing with. I saw like some other questions about documentation in the chat, so maybe I'll just address it real quick. If the provider's notes are, like permanently being saved in the record, I think healthcare facilities can try their very best to train all their providers to be as discreet as possible in the notes and not straight up write patient is a sex worker in a note. try to use like SW or like develop a code word for it, like we say coin patient. And if your like medical record software has any type of features that could be used where there's like a hidden flow sheet or something where that's never going to become a part of like a permanent medical record or won't be exported if sent to another provider, try to like utilize those. And also like to try to familiarize yourself with the landscape of like patient record access in your state. A lot of it's being like expanded kind of rapidly right now, and things like Care Everywhere is one of them. Things like that that expand record sharing across different agencies and healthcare facilities are becoming like more common. And I don't think patients have a full understanding of the implications of that or what would be getting shared. So I think that's a great place to start in terms of protocol for working with sex workers and like documentation workflows is to just try to be very aware of like how your documentation is going to be potentially impacting your patient's confidentiality and to know like where you can actually make promises of privacy and where it's more of a gray area right now.
On the policy front, that is sort of my forte. We can use all the support we can get politically as sex workers. We are it's a very stigmatized profession, so we're shy to speak up typically. Most people are very private about it, and the amount of sex workers impacted by policy compared to the amount of numbers we can turn out to pressure politicians, in addition to our movement is severely underfunded for the number of sex workers that are out there, right? Like compared to any other sort of population you might keep numbers on. Sex workers get pennies in funding for the amount of sex workers out there for anything like organizational support. But right now we're facing a lot of political attacks, including nationwide, these age verification bills that ostensibly would like firstly, they're usually poorly designed. So all the problems you'd expect to have in terms of things not being done right are there. But even if they sort of worked properly, the core idea that they would require anybody who's using the internet in order to access any site that has adult content to upload their ID, even if they got that as safe as possible, that would have a hugely detrimental effect on like the national discourse about sexuality, right? It would put a lot of sex workers in any state where it was in effect. Sex workers are going to be out of work overnight, probably pushed into much more dangerous working situations. And over the medium and long term, it's going to be disastrous for anybody who was trying to be independent, creating their content on their own with having to go through whoever the big dog is that has that verification service. So that kind of thing, like for us, we can say this would be bad for sex workers, but the public doesn't they need like a reason to care. It's very easy for the public to weigh anything as more important than the well-being of sex workers who ostensibly chose their line of work. So for public health folks and for queer folks to be like, sexuality is important, like the effect of not having porn on the internet anymore for normal people, for that to seem like what's normal on the internet, that would be hugely bad. It would be bad for sexual violence, for sexual health, for sexuality, and for queer folk, and could, in addition to being potentially misused, etc. So that kind of like sex, good sex and engage in sexuality is good for your health. That kind of public argument being made alongside the sex worker kind of human rights argument. And in addition, shout out our human rights too, but say like, hey, we're trying to, protect the public health, everybody else's sexuality. We need you guys to speak up about that point.
And just because we're getting close to time, I am going to wrap us up today. And one question we always like to ask at the end of every one of these conversations is really looking at the scope of our conversation, the scope of your work, the world that we live in right now. What is your hope or vision for the future? Thoughts?
So I will go. I guess so. My hope for the future is that I have many hopes, but is that care providers are going to become true allies, that public health folks will become true allies, that patients won't, just have access to services and resources that they need, but they'll be able to be open and honest about their sexual selves without fear of criminalization, maltreatment, stigma, discrimination. My hope is for national decriminalization of sex work, which will, and also paving the way for the sex positivity that you were talking about increased understanding among care professionals and the general public, so that the health of those who trade sex can be elevated to a culturally safe space. And that, that we move beyond cultural competence, because competence isn't that awesome. We want to be more than competent to a healthcare experience that's just physically, emotionally, sexually, and culturally safe, regardless of their gender identity, their sexual orientation, their race, their class, their profession.
Beautiful. Thank you. Ashley, Addison, what are your hopes or vision for the future?
I guess I'll just cop out and go with something we say a lot, which is that we want a world where all sex workers are healthy, happy, and whole, where we're all housed, and so our neighbors, our family, our loved ones, we all have good health care, we all have good food on our plates, we all have enough time to sleep and rest and spend with our families.
I have nothing to add. That was all perfect.
Well, I'm going to add one, Addison. I have a vision of you going through your program to having amazing results and going out in the world and making immense change happen. So I'm going to throw that one right at you.
Thank you. That's very sweet.
So I want to thank all of you for joining us today. I want to thank our panelists for taking time out of your incredibly busy schedules to help inform and educate our listeners here at OutCare Health. And it has been an honor to sit with you today and to learn from your wisdom. I want to also invite all of our listeners today to join us next month when we're turning our attention to community centers and how they can really be a pillar for LGBTQ health equality. Amid this surge in anti-LGBTQ legislation was happening all over the US, our centers are becoming more essential than ever in providing not just a safe haven, but a wide array of critical service, such as wellness referrals, healthcare, community programming, and definitely mental health support. So mark your calendars. We're going to be back here on June 20th, 3 o'clock California time, 6 p.m. Eastern time. And you can look at today's recording and other past recordings at outcarehealth.org/OutTalk. So once again, thank you all for joining us today. Have a beautiful rest of your days and go get your salty or your sugar and have a great evening. Take care, y'all.